A patient walks into a clinic with a confusing presentation. They have yellowish, brittle toenails, an ultrasound showing a fatty liver, and a pervasive, unexplained systemic fear. The standard clinical approach breaks this patient into separate, isolated problems. A practitioner targets the nails, prescribes a metabolic liver protocol, and offers psychological support for anxiety. This diagram illustrates why that direct approach almost always fails. Targeting interventions directly at surface symptoms traps the patient in a cycle of temporary relief and inevitable relapse. A visible symptom is the endpoint of a hidden chain reaction occurring deep within the body's internal systems, not the source of the fire. Treating the physical manifestation without mapping the exact structural violation that caused it guarantees the disease will outpace the cure. Traditional Chinese medicine approaches bodily health as a state of strict boundary maintenance. Every organ system has a specific jurisdiction and a finite allocation of resources. Chronic systemic breakdown occurs when these boundaries are violated. One organ system oversteps its jurisdiction and imposes its energetic burden onto another. To decode this violation, we rely on a specific diagnostic map: the perpetrator, intermediary, and victim framework. The perpetrator is the true initiator of the dysfunction, an organ failing to self-regulate by hoarding resources or leaking metabolic waste. The intermediary is the elemental conduit. It becomes overwhelmed, structurally distorted, and forced to carry the toxic load. Finally, the victim bears the accumulated damage, producing the visible, highly misleading symptoms that bring the patient to the clinic. By shifting the clinical focus away from the suffering victim and back upstream to the aggressive perpetrator, we can stop the cascade of chronic disease at its source. Let's trace this metabolic pathway using a specific clinical presentation: a patient with those same yellowish, brittle toenails and a congested, fatty liver. Standard diagnostic practice categorizes this exclusively as a liver pathology, attempting to fix it by administering liver blood tonics. This 5-element map proves treating the liver is the wrong starting point. The cascade begins at the earth element, governed by the spleen. The spleen is the perpetrator. It transports fluids. When weakened, it fails, generating a murky byproduct known as damp phlegm. This localized failure creates stagnant moisture that cannot remain in the earth element. The excess dampness breaches the pathway, overwhelming the kidney, which becomes the intermediary. Instead of managing clear fluids, the kidney pumps turbid sludge throughout the body. That sludge strikes the wood element, identifying the liver as the victim. It overnourishes the organ, clogging its pathways. Because the liver's energetic flow is constrained by spleen-generated phlegm, the physical damage emerges on the exterior of the body as thick, dystrophic nails. Treating those nails, or even the fatty liver itself, accomplishes nothing. The spleen will simply continue dumping turbid fluid down the pathway, perpetually reinfecting the victim. The perpetrator-intermediary-victim framework applies the same structural logic to emotional and psychological pathologies. Looking at the same elemental pathway, a hyperactive earth element can energetically over-control and suffocate the water element. Crushing the water element produces an immediate systemic psychological consequence, a profound rise in unexplained ambient fear. The fearful intermediary is suppressed, failing to nourish the wood element downstream. Starved of resources, the liver rebels. This creates liver fire, manifesting as sudden anger, irritability, and insomnia. The anger is the ultimate victim. Severe emotional imbalances follow a mechanical chain reaction. Resolving the patient's anger requires rescuing the internal system from fear, which can only be done by subduing the hyperactive earth. The symptoms change depending on the specific nature of the perpetrator's malfunction. Consider what happens if the earth generates internal damp heat instead of damp phlegm. Rather than overflowing the system with sludge, the overheated earth element acts like a furnace, literally boiling away and evaporating the water element's reserves. This induces a state of chronic internal dryness, completely starving the liver and causing the physical tissue to become brittle. The visual evidence on the patient's toes looks identical, yellow, cracked nails. But internally, the rising heat from the dryness overstimulates the heart. Whether the conduit overflows with toxic sludge or dries up completely, The diagnostic logic is absolute. Track the damage upstream and identify the perpetrator. Modern holistic medicine frequently relies on a flawed methodology, the assumption that treating a whole system means throwing therapies at every visible symptom simultaneously. True holism is strict, causal sequencing. You treat the system in the exact order dictated by the elemental hierarchy. This graphic shows the mandatory 3-step sequence for long-term recovery. Step 1 is subduing the perpetrator. The clinician must drain the dampness or clear the heat at the spleen to completely cut off the toxic source. Step 2 is stabilizing the intermediary. With the source cut off, the clinician flushes the pipes, regulating water flow through the kidney and repairing the damaged conduit. Step 3 is rescuing the victim. Only after the upstream environment is entirely secure can you safely soothe the liver's qi and rebend its blood supply. This framework proves that pathology is a structural violation of boundaries, not a random chemical error. Every organ system in the body possesses a rightful role and a strictly defined jurisdiction. When one system abuses its power, hoarding energy or leaking waste, it disrupts the physical mechanics of the entire network. The objective of the clinician is to restore elemental justice, ensuring each system returns to its rightful place and resumes its proper function. Whenever a confusing symptom appears, stop looking at the surface. Map the timeline, check the boundaries, and ask who started it, who carried it, and who is suffering.